All right. Carmen is good. Lernit is good. Dr. Shetty is good. Marcia is good. All right. Beverly, you're good too. All right.
Thank you.
Our family and friends are a big part of who we are. They are our biggest supporters and confidants and our source of bellyfuls of laughter.
And when it comes to keeping you connected, Western Union is here to make it safer and easier with their digital services. Now your family and friends overseas can send you money without leaving home by using the Western Union app or westernunion.com. Just visit gkmsonline.com to register and share your banking details with your sender to start receiving funds directly to your bank account, so you don't have to leave home to collect. Grace Kennedy Money Services, home of Bill Express, FX Trader, and Western Union, doing our part to help you stay safe and connected to the ones you love.
The Jamaica Social Exchange is appealing for assistance for 2 MSMEs whose businesses are adversely affected by COVID-19. Through our Brothers Keeper initiative, we're appealing to you to contribute grant funding for 2 of our special projects, Teen Challenge Jamaica and Monotech Engineering Services. Teen Challenge Jamaica, based in St. Anne, is a program for at-risk youth with addiction problems, operating a farm to sustain its social mission and rehabilitate the youngsters. It is desperately in need of $1 million. Monotech Engineering Services at the Department of Engineering, UWI Mono, repairs broken ventilators and other biomedical equipment used in hospitals island-wide. This project needs funding of $3.6 million. Visit the Jamaica Social Stock Exchange website at jsseja.com for more details and learn how you can donate for impact.
All right, Beverly, over to you.
Good evening, everyone. Welcome to all our viewers on the various platforms. My name is Beverly Gordon. I am the chair of the JDTAN Health Task Force, and it is my great pleasure this evening to welcome you to the JDTAN Health Task Force session on this Diaspora Day celebration, and it is indeed a celebration. I want you to know that I am so happy to be a part of this task force. There are 2 principles that have kept me, well, first of all, that brought me in and that have kept me going. One is the idea of selfless service to others. And the second one is that of collaborating with and forming relationships with other people. And one of the very good relationships that we have formed is with one of our guest speakers this evening, Dr. Ganesh Shetty. He is a naturalized Jamaican who is currently employed by KSA Health Department, Southeast Regional Health Authority, Ministry of Health, Jamaica. He has worked at various child guidance clinics in the region, schools and community, and the University of Technology. Also, he has a private practice at Shekinah House, Seymour Park, off Old Hope Road in Kingston 6. Dr. Shetty has been instrumental in bringing many innovative services to Jamaica in the field of mental health. He is a consultant child and adolescent psychiatrist, and he has, along with his colleagues, has helped over 250 children of areas that have been affected by violence with post-traumatic stress disorder. Presently, in collaboration with NGOs, Dr. Shetty and his team has trained and is supervising the delivery of trauma treatment by youth workers in inner city communities of West Kingston. Time will not allow me to tell you all that Dr. Shetty has done, but let me just say that he's a model Jamaican because he's giving of his heart. And we are so happy, Dr. Shetty, to have you with us this evening as you talk to us about mental health of youth in Jamaica. This is such an important topic because, you know, without mental health, there really is no health because behavior begins in the brain. So Dr. Shetty, welcome. And you now have the floor to talk about mental health of youth in Jamaica.
Thank you, Dr. Gordon, and greetings, my brothers and sisters. One love, one heart, one destiny. I would like to speak about mental health. Can I share my screen, please? In children, but also I would like to speak about the impact of COVID-19 pandemic on CRIVID epidemic, that is crime and violence disorder, which has been around for a long time. Thanks to Caribbean Association for Child and Play Therapy Learning Collaborative helping with this presentation. And these are the areas I'm supposed to focus on, looking at possibility of you guys helping us to do more, but I would like to focus on the weakest link, which is children who live in volatile and vulnerable community or youth in difficult circumstances. And I will have to run at the speed of Usain Bolt with my presentation, because usually I do this in an hour's time, so 15 minutes. I might skip some slides which are not important, but I'm going to post this presentation on my YouTube channel, Dr. Ganesh Shetty, and if you are interested, you could please watch it at leisure, and please give me your constructive feedback. So, CRIVID endemic, crime and violence disorder. We must all be tired of looking at grisly, gruesome headlines in the newspaper and on TV, and also it's stunning how younger and younger children take up guns and get into life of crime. But the question is how an innocent child becomes a violent youth, how a violated becomes violent. I would like you to listen to this YouTube video, which one of my brethren did for me, and that will tell a lot.
Attention, everyone. Please hear me out carefully, or else you may pay dearly and regret dreadfully. This is neither a fiction nor an attempt to monsterize anyone. Who am I? I'm the one who may arrive as a result of unplanned or unwanted pregnancy, disowned by the heartless father, abandoned by the worthless mother, fated to face endless atrocities. I am the barrel baby who is forced to bounce around in the care of uncaring relatives. I get exposed to age-inappropriate TV and violent movies. Yet, if I ever get tempted to emulate, the devil is beaten out of me. I am one of 6,000 children working and living on the streets. And I am also one of many underage girls working or dancing in the nightclubs. I am teased as AIDS hit me because my parents were killed by HIV. When I can't take it anymore and I act out, I am labeled as uncontrolled and I'm locked up in a so-called children's home or correctional facility. I am just a neglected and abused child, forgotten and forsaken. They call me lazy crazy at home and pretty dunce at school. I can barely read and write properly. Very weak in basic maths and history. Ashamed, I skip class to join my buddies under the mango tree and smoke some weed and all on day. I am just a child, untreated ADHD or learning disorder. I often witness violence at home, school, and the community. I am afraid even to take the bus or taxi, fearful of parents and teachers who love to punish us physically, suspicious of people from certain class and community. When I buy my clothes, I wonder which color shirt should I buy? What if people see my color shirt and associate me with certain party affiliation and attack me? Sometimes I get caught in crossfires, or even get murdered in a fake encounter. Horror grips my attention firmly as flashbacks haunt my memory. I am just a brutalized with PTSD, reliving the trauma daily. Sometimes I get recruited by the drug lords and the area done and graduate from just a school youth carrying guns in my school bags to a little gunman, fully trained to rape and kill mercilessly. I am just an unfortunate, emotionally dead youth unleashed on this wretched society.
So this young man said it much better than I could ever say. And when we looked at the problems our society faces, crime and violent behavior, substance use, teenage pregnancies, street children, school dropout, child prostitution.
Where should you put your money? People ask me all the time, they say, I got $10,000, I got $20,000, $5,000, $150,000, whatever the number is, people want to know.
Like a Zoom bomb or YouTube bomb. All right. Hope they don't trouble us again. All right, sorry about that. Yeah, so when we look at long-term effects of adverse childhood experience, which can increase our risk for diabetes, cancer, heart disease, and so on, we have to look at these sources which fuel these unleashing and evolving over time. And poor parenting skills, poor psychosocial support, adverse childhood experience and trauma, as well as unidentified and untreated mental disorders in youth fuel these problems. And we know about poor parenting practices, corporal punishment is condoned, and children should be seen, not heard. And we have the issue of barrel babies and bounce around children, and poor psychosocial support. 1 out of 4 children live in poverty and they don't have running water, sanitation, get pregnant during teenage, the father's address not to be found. So make us wonder if the bridge of life is broken and children are falling through the cracks, and we are trying to pick them up one by one with our expensive helicopter and speedboats, but not thinking of building the bridge of life. And when we look at adverse childhood experience, all kinds of abuses, neglect, domestic violence, substance use, incarceration, can also leave long-term impact on us. Children have nowhere to turn. They experience violence at home, school, and communities, and they're locked up in the house early because their children, parents don't want children to go out and get into some problems because the environment is not safe. And even the depressed can get angry and disruptive, not to mention the plight of children working and living on the street. Also the issue of identity. Am I black enough, white enough, fat enough, thin enough, sexy enough, Christian enough? And who are my role models? And the impact of virtual work brings up its own kinds of problem, porn and predators on internet. Because mental illness doesn't show on your face, on your body, it's usually missed, and they resort to thinking a child is just a cry baby, rude, out of order. All it needs is 2 licks. And if we estimate there are about 800,000 children in Jamaica, and WHO says at any given time, 10 to 15% of children might experience a mental disorder. So we take an average, 15%, and 5% of them might have a serious mental disorder. It works out 120,000 in Jamaica might have some kind of mental disorders or other, and 40,000 of them will have a serious mental disorder. And to help them, we have about 20 child guidance clinic sites, and only about 3 of them work full-time Monday to Friday, and 15 clinicians only work exclusively with children and adolescents, and rest 35 mental health officers and psychiatrists try to thief some time from their adult responsibility and give to children. So, for example, in 2018, we saw about 3,500 children over the year, and they had about less than 4 sessions, and 40% of them did not keep appointment. And it is very important when it comes to chronic disorder like ADHD, conduct, and PTSD, because it'll be a waste of time if they don't go through the course of treatment. And the research shows that these are the ones who are likely to drop out of school and get into crime and violence. And when we look at different areas, we have disproportionate amount of caregivers to deal with children with mental disorders. So what happens as a result? More than 95% of children with mental disorder do not get seen in a government setting. And even those who get seen on an average get about 4 sessions, which is not adequate. What is the problem? Is it poverty? They can't afford the bus fare, they can't take time off work, or they're afraid of crossing the enemy lines in the inner city gang feuds. They expect miracles. Is it manpower? Is it lack of coordination? When we look at the diagnosis, we have about 6 of them in the top, which are quite frequent and are often associated with crime and violence. And when we are grappling with those issues, COVID-19 visits Jamaica, and I wonder what is common between Wuhan and August Town. It is the money, because people who were selling rat, bat, and cat in China did not get money for it. They did not sell it, and the virus will not jump to human beings. And as somebody said in August Town, if Don doesn't get money, can't buy guns, and his people cannot go and shoot people. So is COVID an equalizer? Is it a reset button? Something to think about. But also, we need to look at monetary, military, missionary, and materialistic system, which fuels a lot of these problems. And make me wonder, when Master left in 1962, when Jamaica got freedom, did we dismantle his house? Probably not. And we had to look at how some of us who shy away from places of power, office positions, and a lot others who are less qualified and maybe part of the problem to take those places, and how JDF has to fight the DDF, that is Don Defense Force, and how we can integrate Dominica, which is part of Jamaica, which is ruled by Don, where they have different rules, integrated into Jamaica without damaging or hurting people who live there, innocent people who live there. So, and also we have to think about why we are burning petrol to get electricity to run our houses when we have so much sunshine, wind, and water, and why we have to import rice to make rice and peas when we can grow anything in this very fertile land. So we have done well in terms of COVID, and some of us have fared better than others, and some have return of the post-traumatic stress symptoms. So COVID pandemic is an additional stress on pre-existing crime endemic, with caregivers, breadwinners being sick, becoming sick and dying, school closing, jobs lost, business coming bankruptcy. It will add another layer of stress, which can increase the problems. But it is a very terrible crisis to miss. And it's time to get the village together to raise the child, reducing the risk factors, increasing the protective factors, finding a holistic approach to help the children. We have to come out of the clinic and go into school and community. And we have to use all technology, telemental health, mobile mental health. And we have to change our approach, not to see who come to the clinic and hope they show up again. We have to go and find people who need help and train those who can help them, and find other people who need help. How much time I have, Dr. Gordon?
Actually, Dr. Shetty, I hate to say this, but you're out of time.
Oh my God. All right, I'm going to skip everything and go to what is important. So this is what we have done over the years, help a lot of children through a lot of trainees. And what we plan to do now, where JDTAN can have a big role, is attacking the foundational causes which fuel these problems. And that is in collaboration with other agencies. And we have to also look at funding. I don't like to get funding from big agencies because they give you funding for 2 years and expect government to take it over, which never happens. And also we need to work together. Agencies should not only share task and shift tasks, but also share resources. We have to look at what schools are doing and increase the good ones, practices we have there. And I want help to start a training program where basically we are training people in the clinic to go to the communities and train people in the community to help children in the community. That's a 3-month program. And then the same people in the clinic will help people in the school to help children in the school who need help. And the people in the clinic will be trained by the faculty, which has local and international experts who are willing to donate their time. And this is what we are doing. And it is different because it's a problem-based approach where we're going to ask them to see patients and come and attend the classes rather than just attend the classes and go home and forget. So we will have a cascade model of training, which will help us to train army of caregivers who would help hundreds of children who need help. And we might make little dent in the number of children who go without help. And the question is, what about the money? But we are spending money already. 8.6 billion is lost in caring for those who are injured every year. So if we can unite, shutting the red eyes and transforming the bad minds, there's no problem our creativity and ingenuity cannot solve. Thank you.
Thank you so much, Dr. Shetty. You bring so much information, so much valuable information. I'm going to have to ask you to come back another time in another setting and possibly share some of this material with us again.
Not a problem.
Thank you so much. And so now we will move on to our next speaker, Nurse Carmen Johnson. She is the president of the Nursing Association of Jamaica. And as everybody knows, nurses are pretty much the backbone of the healthcare system. And so I'm going to ask Ms. Johnson, I don't have enough time to tell you of all her stellar professional experience, her distinguished professional accomplishments and awards, but she is a registered nurse, a registered midwife. She holds a Master of Science degree in Human Resource Development, and she also has certification in healthcare administration. Nurse Johnson.
Good afternoon, Dr. Gordon, and good afternoon to the other members of the panel and to our listeners. Thanks for having me. Quite privileged to be on your panel this evening, and I trust and hope that I'll be justifiable be here. My topic I'm asked to speak on is the role of Jamaican nurses in ensuring good health for the Jamaican populace. Jamaica has approximately a little over 2.9 million citizens in the country at present, based on our last count. And within that, we have 330 health centers and 24 public hospitals. And we have just under 5,000 nurses. So that alone will tell you the burden that our nurses bear in order to ensure that we are able to see to the healthcare needs of the populace. To achieve health for all, we need to have a people-centered approach, meaning that we need to be able to look at the individual, the community, and the population at large. And we must shift beyond the biological and this pathological view of healthcare. In saying that, what we need to do is to look at the social, economic, political, scientific, and the cultural aspects of the population that can advance good health, which is also dependent on access to safe drinking water, good nutrition, adequate sanitation, education, equity, the conditions under which our children are born, which they grow up, which they live and work, and how we age, the conditions under which we age. And so one of the challenges that we continue to look at healthcare as a means of just addressing the healthcare needs once they arise. Our Minister of Health had gone a little further to ensure that we are changing that outlook to look at wellness, to ensure that we are looking at the wellness portfolio. And in ensuring access to affordable, accessible healthcare, our nurses have been playing their role. And what we have sought to do is to seek to engage at the policy level and at the advocacy level to ensure that we have a health system that is responsive to the local and the national priorities as it relates to health. And what we seek to do is to try to be at the coordinated end of it, where we ensure that healthcare is coordinated from the policy making perspective to the healthcare delivery perspective. And so our nurses have been participating actively. We have our public health nurses, our midwives, our RNs, our specialist nurses who operate at the primary care level, who seek to ensure that the healthcare delivery needs of the populace is met at the community level. And what they seek to do is to ensure that they are more so looking at promotion and prevention, where they seek to promote good health and wellness and seek to see how they prevent illnesses such as COVID and other diseases from engulfing and having that devastating impact on our populace. And one other thing I must say is that our public health nurses have done well over the years. Our immunization rate is up at about 98%, and we are comparable to other third world as well as first world countries. And so they have been playing their role in ensuring that the populace remains healthy. They also play their role in ensuring that we have a good maternal and child health, because one of the issues that we grapple with and that the WHO is seeking to reduce is our maternal death and our neonatal death rate. And so our nurses have been ensuring that we continue to have baby wellness clinics to ensure that we continue to conduct our antenatal clinic, our family planning clinic, and our postnatal clinic. And when persons have not turn up for this clinic, they seek to ensure that they do their surveillance to track these patients down and to bring them back to the clinic to seek to ensure that their healthcare needs are met. While we continue to operate in the secondary care level, one of the things I must point out is that our healthcare delivery systems seem to be more lean into secondary and tertiary care. And because of that, what you find out is that we have used more to seek to re-engage our patients and the populace into a better state of good health rather than at the preventive and the promotive stage. And what we want to do is to seek to continue the engagement, continue the advocacy to ensure that we have a more robust primary healthcare system that is responsive to the needs of the populace at the community level. Our nurses continue to participate in health literacy. And so we do that from the primary care perspective, as well as our nurses who are in education. And so we have over 200 nurses who are employed to educational institutions. And they are a part of the whole health literacy and the occupational health and safety within our education institution, where they seek to address the risk of our students that will exist, and for those who already have existing pre-morbid condition, that they seek to attend to them and to ensure that our upcoming populace is maintaining and is achieving good health and wellness in order to become the citizens who will be the leaders of tomorrow, when those of us who will be retiring earlier, those who have already retired. But what we continue to do is to seek to support them to ensure that they are champion the occupational health and wellness of our children in our secondary schools and in our tertiary institutions, as well as the basic schools. Our nurses continue to play their role in ensuring that we operate at the policy level. And so with that, we have our chief nursing officer who sits at the Ministry of Health level. And she seeks to participate in the whole development of policies to guide the healthcare sector, both from primary to tertiary level. And as an association and as an advocacy body for nurses and for healthcare within the country, we also seek to ensure that we conduct research and in participating in research to ensure that we are using the evidence that we gather, not only to advance our practice, but also to advance the development of policies that will impact healthcare within the Jamaican populace. Our hope is that as we seek to move forward, we'll be better able to retain our nurses, because presently we're at approximately 1 nurse to 1,000 of the populace. And in primary care, we are at approximately 1 nurse to 10,000 members of the populace. And so it tells you that many days our work hours goes beyond the 8 hours that we are engaged for. And at the same time, we are also on call, whether paid or unpaid, because the populace must have access to that healthcare provider, and the nurse is always that healthcare provider who is always available and accessible within the primary healthcare setting, within the communities, to respond to the needs of our populace. Nevertheless, we continue, and we hope that we will seek to get to the point where we continue to not only just advocate for retention of our nurses, our highly skilled nurses, but that we are actively ensuring that we are retaining them. Our nurses are also active in surveillance and contact tracing. And one of the things that has worked so very well for this country is that our primary care nurses and our secondary care nurses, our infection control nurses, who have been active in surveillance, they have been the vanguards and the watchdog for the protection of the populace. And so once we recognize in any area of the country that there's a shift in any disease process, or we recognize that we have an increased numbers of persons coming in with any specific signs and symptoms, we tend to communicate that across the spectrum of the healthcare facility so that we can have our antennas up and ready and looking out, and not only just looking out, but putting our risk management processes in place so that we can address the what ifs and also to prevent disease outbreaks. We continue to look at policy development as it relates to the spatial area. Where do we operate from, where our patients come in to have healthcare delivery? Because if our facilities are not accessible, if they are not acceptable to the populace, then what we find out is that many of our patients do not return to these facilities for healthcare. And so we continue to seek to let our voices be heard and also to assist in the development as to how our facilities should be so organized and the functionality of them, to ensure that we have adequate staffing, not only from a nursing perspective, but also support staff and administrative staff, and continue to look at supplies management. And so our nurses participate in the whole supplies management to ensure that we have what is required to address the healthcare needs of the populace. And so as we continue to look at what we do, we tend to look at the health models that are operating, and we'll suggest new models or different ways of doing things to ensure that we are meeting the needs and that we are also taking into consideration the human rights of our patients that come into our facilities for healthcare delivery. And as we continue to ensure that we know it's challenging and there are competing demands, but we continue to say to the policymakers, health must now be and should have always been part of the policy development of all the various ministries across the sectors within government. And COVID has come to prove that when you have a health crisis, it affects all ministries, all departments. And so we continue to advocate and to say to them, we want to be a part of the whole development as to how these ministries and these various agencies look at making healthcare not a burden as it is seen, but a part of the necessary good of that facility and those agencies. And so our nurses continue to function. I know the diaspora can assist in many regards as it relates to support for training. And when we look at many of our specialist nurses who have left our shores, the diaspora can assist in that to see how we provide the clinical area and the clinical partnering with the country, partnering with the association, with the ministry, in ensuring that seeing we have limited physical space for our specialist nurses to be trained, that you continue to partner with that in that regard. The provision of equipment and supplies, because as we're fully aware, store budgetary allocation and the competing demands. And we just want to say thanks to members from the diaspora who have continued to provide and to assist us with the provision of the necessary equipment that we need to function. One of the things that we want to collaborate with is research. How do we look at the researches that we do here and what you do there to advance the whole healthcare delivery process and to make our healthcare delivery process much richer for the populace, not only here, but for those across the diaspora. And also in how we advocate for the development of policies that seek to speak to and address the healthcare needs of those who are our returning residents, as well as our citizens who continue to live here. And that it is at that level that we want to have our infrastructure, our human resource, and the equipment and the supplies that we should have. And so as nurses, we continue to do what we have got to do. And we just want to say thanks to all our nurses across Jamaica who continue to provide healthcare and to ensure that the populace remains healthy and remain safe, and to those across the diaspora who continue to put their lives on the line to ensure that the healthcare needs of the populace across the spectrum is adequately addressed and that they are cared for. Thank you.
Thank you so much, Nurse Johnson. And we will be talking in the future regarding collaboration. To move on now, we've heard from two persons in Jamaica who are on the ground, key individuals in the healthcare system. Now we're going to look at some of the individuals who are here in the United States who have been contributing as part of the diaspora to the healthcare needs of Jamaica. The first person we'll call on is Mr. Patrick Williams. Patrick Williams.
Hello.
So,
can you hear me?
I can hear you. I'm not seeing you, but I can hear you. Okay, go ahead.
Can you see me?
I can see you. And Patrick Williams is the president of the Jamaica Awareness Association of California, correct?
Correct.
All right. Go ahead, please.
Is he frozen?
Yes, I think we're having a little difficulty there. So we're gonna go on to Dr. George Savage, who is
Can you hear me?
Patrick, we can hear you. Go ahead.
You can hear me? Okay.
We can hear you now.
Okay, great. All right. Dr. Beverly Gordon, Mr. Leo Gillen, other members of the panel. Good afternoon or good evening, as the case may be, according to Oliver Samuels. And thanks to the JDTAN for this opportunity to share with you the work of Jamaica Awareness Association of California, JAAC. On behalf of the organization, it is my distinct pleasure to extend greetings. This organization was formed in 1987, 33 years strong, and mission goes on and on. JAC is a 501c3 charitable nonprofit organization founded in Los Angeles and have been supporting Jamaica through our medical and education outreach mission for over 21 years. Since the inception of our mission trips to Jamaica, we have provided services to all parishes while significantly increasing our services both in health and education. Just to name a few, but not limited us to: adoption of schools, performing hundreds of clinical surgeries, providing medical and dental services, conducting health and education forums, feeding and servicing the needy families, starting a dynamic scholarship program. The celebration of our 20th annual mission trip to Jamaica last year was a significant milestone, with over 90 volunteers from the United States, comprised of physicians, dentists, nurses, nurse practitioners, dietitians, pharmacists, administrative personnel, educators, counselors, and our dedicated members. Conducting surgeries, which Dr. Savage will share more on, provided dental care to over 800 patients, and that includes over 300 of Rockabessa Bay Primary School in St. Mary. I get that right, Mr. Gillen? Rockabessa? We have conducted a daily medical clinic to over 1,500 patients, awarded 7 5-year scholarships to qualified students, making the current number a total of 14 scholarship recipients. In addition, we have donated backpacks and school supplies to over 3,000 students, and we also conducted nursing workshop at NCU. All of these services were totally donated free of cost. Allow me to share a few details here before I close. The cost of our 2019 mission was approximately $120,000 US. This was made possible by many generous donations and fundraising efforts. JAC 2019 donated services, equipment, and supplies were valued at over 550,000 US dollars. Over the last 20 years, we have impacted over 40,000 lives across the island in both health and education. And so the work of JAC, improving lives today for better tomorrow, continues. As we were looking forward to our 2020 annual mission trip, there comes COVID-19 and mash up with business. This would have been our largest mission trip to Jamaica with approximately 120 volunteers. However, we're committed to support our beloved country. And in short order, we will be sending a shipment of medications, laptops, tablets, and well-needed supplies, more like an abbreviated mission trip. Please visit our website at www.jamaicaawareness.org. Find out how you can become a member, be a sponsor, volunteer your expertise. Thank you.
Thank you so much, Mr. Williams. I'm so glad that we got you back online. Thank you.
I'm glad.
And now we're going to have Dr. George Savage. Dr. George Savage is Jamaican born. He's a board certified OBGYN physician, and he is a member of the board of, he's a member of the executive board of the JAAC. Dr. Savage.
Hi, everyone. Thank you for your time. I am really impressed with the two previous presenters, and I'm flabbergasted at the level of deficiencies we have in the country, because I knew it existed, but until it's like put in paper and in words, you can't really appreciate how dire the straits are. In any case, I've been with JAC for 2 years now, and we typically go to Jamaica in June. We go to 4 hospitals, and last year we did like between 30 and 40 cases. The team comprises of 3 OBGYNs, 1 trauma surgeon, 2 general surgeons, and a whole bunch of dentists and dental students. We typically arrive on like a Saturday, get on the Sunday, we do presentations from the latest technological advances in America to try and impart to the Jamaican physicians. And we usually have attendance of about 200 people every year to these things, to these seminars or presentations as we call them. COVID prevented us from going this year, but we had over $10,000 worth of medicine that we're still planning on shipping before they expire to Jamaica. Hopefully they can be used. I'm sorry for dodging in and out of the line, but I'm monitoring 2 computers and another phone. Because I'm on call, so it's very difficult for me to stay still. So I don't have ADHD. I'm so busy doing a lot of different things. What else can I say? I offer nursing scholarships to some nursing students in Jamaica. And as I'm on this call right now, and I'd like to let you know, guys, that I was born in Denham Town. I saw a lot of those killings and everything else. So I understand the PTSD that these kids are going through, because I'm sure I suffered from some of that. I guess, manifested it differently from almost all my other friends who are now dead or in jail or, in not so good places. In any case, I think I've decided just now to sponsor several kids from my primary school to go to high school, because at some point you guys gotta help as best you can. So other than that, I have nothing else. The JAC has been very good in trying to stop the gap, but there's such a big need there that we're trying to expand to more hospitals, but the logistics of and equipment that we need, they don't have it there, and it's very expensive. We can't, our organization is not so robust in terms of funds to buy these $100,000 equipment to give to these hospitals, which we would if we could. But we continue to fundraise. We have banquets, walkathons, those kind of things to generate revenue to put to good use. I'm sure we can't afford $100,000 equipment for every hospital that we'd like to send it to, but we're trying to do the best we can. I talk really fast. Forgive me. I have to go on another Zoom meeting. So that is all I have. You guys are great. I'd love to hear more from the other two presenters. And keep up the good fight. Thank you.
Thank you so much, Dr. Savage. Thank you so much for spending that time with us. And it was good to hear from you and of all the work that you're doing. And I love the fact that you're speaking from the heart, you know, and responding to what you hear.
I did have two questions for Nurse Johnson before I go. I wanted to know how many nurses graduate per year and how long does it take for a nurse to get a license?
We have over 500 nurses who graduate per year, but we have approximately 400 who sits the regional examination for nurses registration. Because as you're aware, not all meets the requirement for that final exam. And what was their next question? It doesn't take long. Once they have sat the RENR exam and have passed it, we have two sit in April and October. Usually within a month to 6 weeks, they are registered and licensed by the Nursing Council of Jamaica.
Okay, so we're gonna actually have to move along a little bit now. There is a question and answer period at the end. So let me go on to our next speaker, who is Lornette Patrick. She is the president of the Jamaica Nurses Association of Florida. She's a graduate of Wolmer's Girls High School in Jamaica, graduated from nursing and midwifery schools in England, graduated with bachelor's of Science and Master of Science degrees in nursing from the University of Miami. She has worked for over 30 years at Jackson Health System as a registered nurse and for 8 years, and later as an advanced practice registered nurse. She was part of the South Florida delegation that attended the first Diaspora conference in Kingston, Jamaica. And she is proud to be a member of the Jamaica Nurses Association of Florida. She's currently serving as president. Ms. Patrick?
Hi, good evening, everyone. Can everybody hear me? Can you hear me?
Yes.
Yes. Good evening, everyone. Dr. Gordon, I thank you so much for inviting JNA to be a part of this panel. I'm just so pleased and so pleased to see all other panelists as well. I'll be giving highlights because I could talk forever about JNA. I only have 10 minutes. It's going to be pretty as well. Just to give a brief history, the 1983, December 1983, by Mrs. Joyce Harris Wright, with the initial goal of assisting nurses from Jamaica to transition to work in the United States of America. In 1984, JNAF was incorporated, and our motto is "Together We Achieve." So regarding donations, since JNAF inception in 1984, from then they started to send medical supplies and equipment to Jamaica. And we have continued that until today, 2020. In the past, we've also given donations. We had a drive going for KPH dialysis unit. And also the last year, we donated bassinets to the Spanish Town Hospital. When it comes to education, I'm so glad to hear Mr. John talk about education. Our goal is to educate whether the patients about their diseases and how to manage same or to nurses regarding current healthcare and the current trends in nurses. Just to give you a quick background, in 1995, JNAF held the first 3-day seminar at UHWI for nurses. And this continued from 1995 to 2003. We not only gave lectures then, but that during the morning break, we would turn around and feed the participants. So we also fed them as well. We've also lectured student nurses at NCU and also nursing students at a nursing college in Brownstown Hospital. Now, when we go on our medical missions, normally we go to a site and we have gone to various clinics where they've asked us to give them education, especially regarding wound care, because there's current trends and they're wondering why the patient's wounds were not healing. So we took stock and showed them what they were using wasn't the correct thing to do. And it took some feedback. Better than, which we know is not really, it killed the goods. So we had to clean the goods, did the academics, and this was very, very well received. We have also gone to Mission of the Poor, Father Holong, downtown Kingston, and also educated the brothers and the sisters because they do a fantastic job in that setting as well. And talking about Dr. Johnson, Mr. Johnson talking about nurses educating themselves in various areas. Jackson Health System, where I previously worked, I've hosted Jamaican nurses to increase like a 1 week or 2 week training program. And once we found out that some nurses from Jamaica were here, members from JNF actually went to the hotel and we checked them out, and nurses, we host them in our homes. And we're able to interact with them to see, you know, how they found nursing here in the States versus nursing in Jamaica as well. So we just focus a lot on education, and we have continued that trend as well by awarding 2 scholarships to nursing students in Jamaica. And this is in honor of our founder, Mrs. Joyce Harris Wright. And we coordinate with Mrs. Johnson from the Nurses Association of Jamaica. Medical missions, and I've heard the best doctors talk about medical missions. It's so good for us because the need is so great. They have a very good system in Jamaica, but it needs help, definitely. And we go to different parishes, and this we started in 2006. And the first mission was with Hope Ministries. And on that very first mission, we went to Rocky Point in Clarendon and Victoria Town in Manchester. And at Rocky Point, we discovered a young girl walking on her telephone foot. She could not connect the torches just couldn't do it. And she said the child needed surgery, but she didn't have the money to pay for the surgery. On returning to the States, one of the members sent the money to the mom, and the child had the surgery. Can you imagine when we went back the following year to see this child? She had had the surgery, successful, and she had shoes on. So that was just totally rewarding. So Rocky Point, we have adopted, we're like family, they look forward to seeing us. We used to go every year, but because of cost, we now go biannually as well. We also coordinate with the Kiwanis of Kendall South Dade. So we now call it a humanitarian mission because the Kiwanis, they would take books, supplies for the children. While they do, we stay behind doctors, nurse practitioners, we've had dentists on a couple of occasions with us, and we do the medical part. On certain days, we'll see like over 140 patients in one day. We travel from Kingston to various parishes every day. When we come home in the evening, we pack for the following day as well. It's very tiring, but it's very, very rewarding. I'll give you one more example of a patient who we saw on one of our visits. This young lady, she was 3 months pregnant, and she having palpitations, and she said that her heart was beating so fast that she felt her heart was coming through her chest. She had gone to various healthcare providers, and they told her it was anxiety, and she was anxious. So the nurse who was triaging that patient said she was very slim, and here this young lady, her neck appeared swollen. So she took her to a doctor who was with us, and he immediately ordered a thyroid profile for her, which was done in Jamaica, of course, and she was treated. She had hyperthyroidism, and she had a baby, and that nurse and that patient still keep in contact as well. So although the missions, we don't just go, see them and leave, there's a bond with some of the patients there. And on occasions, we have had, even in our home, taken in post-op patients who came up from Jamaica for surgery here, and they needed to stay for 2 more weeks before going home, and they had nowhere to stay. So one of the members took in this person for 2 weeks, and we not only kept her, we paid her fare to go back to Jamaica, we ensured that she had follow-up care, and up until this very day, we have still kept in contact with her. She was doing very well, having the issues right now, which we'll continue to monitor. So we also assist with the patients. Again, we see them hospital issue. These patients, they know their diseases. Sometimes they come to us with their prescriptions. They just don't have the money to buy the drugs. So we give them drugs about 2 months or so, or probably 3 months if we have enough. And we ensure that after we leave, they follow up with the local clinics. And the clinics are there, you know, and we can go and we give them a paper to show their provider, you know, we saw them on this date, this was their blood pressure, blood sugar readings or whatever, and what we gave them, and they must follow up, because after 2 months or 3 months, medication is going to finish, and then they'll have recurrence of their problems. In 2003, we adopted the National Children's Home. And they're like our children. We go and visit and we take stuff for them, and they will send us a needs list. And then we will try and fill that list as best as we can as well. That's a bedding, toilet articles, and we form a bond with the children and also their caregivers as well. So can you imagine how devastated we were about the fire that destroyed the children's home? I feel that my home was destroyed. So we've kept in contact with them. We have sent money for the last year, and the letter that we got from them was just totally, so they're so appreciative of what we did for them. In 2018, JNF was awarded the Prime Minister's Certificate of Achievement, which was accepted by our past president, Joan Howard. Now, I cannot leave without mentioning COVID-19 and what we're doing in Miami for healthcare providers. We do have a project committee, and this is chaired by Dr. Belen Allen, who coordinated meals which we took for the evening style, over 120 healthcare providers at Jackson North Medical Center, where we have our monthly meetings, and also the 2 nursing homes. And just about 2 weeks ago, they were part of a COVID-19 testing site. But they actually didn't do the testing, but they were there as educators, registration, and also giving care packages. So we live in the States, but our heart is in Jamaica. And we have a dynamic group of members, mainly females. We have about 2 males. Mayor Dale Holden is also a member. We're taking more guys to come join us. They go over and above the call of duty, over and above the call of duty. And they ensure that our motto, together we achieve, stays strong. Thank you so much.
Awesome. Thank you so much, Lornette. Thank you. So Dr. Trevor Dixon is currently taking care of the sick, which is what he's sworn to do, right? So he's in the right place. So we're going to move on to Miss Marcia Amersing. I want to introduce her as she is the vice chair of the JDTAN Health Task Force, and she's a pleasure to work with. Marcia Beaumont Amersing is from St. Anne, attended York Castle High School, Dental Auxiliary, and the University of the West Indies, where she completed both her Bachelor of Psychology and Master of Science in Counseling. She practiced in the field of dentistry and taught A-level psychology at Convent of Mercy Alpha Girls School and quality academics before migrating to the USA in 2006. She is the executive director of Renewal Integrative Psychotherapies, LLC, a mental health and substance use clinic in Worcester, Massachusetts. She's also the president of Renewal Sober Living Incorporated, a sober home for men in recovery, and manages a private practice, Amersing Integrative Counseling Services, LLC. Marcia.
Good evening, everyone. I feel very honored to be part of this panel and part of this team. And I want to recognize Leo for heading JDTAN. I think it's a superb organization with just so much passion. And I really feel honored, especially to be one of the chair in one of his task force. And I just want to shout out to my behavioral health task force too, because I'm part of that team as well. And Dr. Shetty, I want to just say that your presentation was remarkable. It definitely gave us an insight into areas that we can contribute to. We'll be reaching out to you, I'm sure, right, Bev? Pretty soon, both for our health task force and behavioral health task force. But that is not really what I want to talk today about. I want to share just my passion about mission work, and that I am also part of another mission team that I started in, not I started, but I became a part of in 2014. And that is Mind, Body, and Soul Health Ministry. So Mind, Body, and Soul Health Ministry is a nonprofit organization, and it's managed by a board with Hillary Morgan, the president. And this ministry is based in Brandon, Florida. We provide a continuum of care and educational services yearly that promotes healthy lifestyle for Alexandria and surrounding communities. And Bev did say I'm from St. Anne. So we basically went back to our roots. Most of us were born at Alexandria Hospital, which was later downgraded to a community health center. So we're really trying to work on that project, making it a hospital again. So we've collaborated and established partnerships with local community healthcare workers, social workers, government agencies and businesses, local churches, schools, and also volunteers from the communities. As a result, we have seen increasing positive results from year to year. Our team of volunteers includes nurses, doctors, dentists, orthotics, ophthalmologists, social workers, educators, evangelists, and manual laborers. In addition to those services, the mission provides school supplies, food, clothing, agricultural products for farmers, and also medications. During our mission week, which is usually the first week of August every year, but COVID killed that this year, we're not able to go. Persons receive dental care, pap smears, mammograms, wound care, school physicals, prosthetic services, eye examinations, and general curative and preventative services from our professional team. In addition, we provide educational seminars on preventative healthcare, sexually transmitted diseases, healthy lifestyle, and other pertinent topics. Team members visit individuals who are shut-ins and provide them with items for basic needs and medical care. Mind, Body, and Soul have also collaborated with a team of prosthetics headed by Mr. Kerry from Felter, and have donated approximately $1 million in prosthesis to numerous amputees from all parishes of Jamaica free of cost. The prosthesis missions are done throughout the year, and they involve assessing and measuring initially, followed by the fabrication, which is done here in the United States, and then a return visit for fitting and therapy. Mind, Body, and Soul have also collaborated with an eye team to perform cataract surgeries. This team includes ophthalmologists, nurses, medical students, and an anesthesiologist. These individuals are usually from India, USA, and even some from Jamaica. The team has done to date 5 very successful missions, completing over 1,400 surgeries without any complications at Mandeville Regional Hospital. And this is between 2014 and 2019. Mind, Body, and Soul partnered with the Patel Foundation for Global Initiatives to provide all the lenses, equipment, supplies, accommodation, and travel for the mission trips. Pre-screening and follow-up care are done locally. In addition to cataract surgeries, individuals with other eye problems are examined, and free eyeglasses are prescribed and distributed. In 2018 alone, over 850 patients were examined by the optometrist and 798 pairs of glasses distributed. This partnership with the Patel Foundation, headed by Dr. Kiran Patel, plans to refurbish and upgrade the Alexandria Community Health Center back to the hospital status, which was downgraded about 30 years ago to a clinic, providing limiting outpatient services. The need for a hospital is greatly in demand, as the nearest hospitals are St. Anne's Bay Hospital, which is probably about an hour away, and Spalding's Hospital, which again is an hour away. And so I personally have lost family members because I am from the Alexandria, Morrimount, Alva area. And I personally have lost family members due to distancing. You know, they never got to the hospital on time. So as a result of the mission's effort, the first phase of the hospital renovation is completed. Yeah. The dental clinic and the pharmacy have been refurbished. The dental clinic is now equipped with 3 fully furnished dental suites, both projects at a cost of over $500,000. I can tell you how much better it feels working with all these new equipment and with the air conditioners. back in previous years, we used books as fans, you know, and now we turn the air conditioner on for the whole day. Feels better. Mind, body, and soul total contributions to Jamaica as of 2019 in April is approximately 220 million Jamaican dollars. Mind, body, and soul are presently in negotiations with a dialysis equipment provider for units to set up clinic in Jamaica and hoping to secure land space. And in addition, they're in dialogue with seeking approval from the government of Jamaica to provide cardiovascular surgeries through sponsorship from Heartbeat International, a nonprofit organization in the US that specializes in heart surgeries. Mind, Body, and Soul intends to add diagnostic services, inpatient medical and maternal care, and quality outpatient services free of cost or for minimum cost to the poor people of Jamaica. They have entered a public-private partnership with the government of Jamaica for the upgrade of the hospital infrastructure and services. And so we plan to continue this collaboration effort to reach our end goal, which is to see Alexandria Hospital back to hospital status and being able to support the surrounding communities of K Valley, Brownstown, Alexandria, Alva, Morrimount, Essen Castle, and so on and so forth. Thank you so very much.
Thank you, Marcia. Okay, so now we have a couple of questions that we're going to direct to members of the panel. Savannah Steele says, I am deeply grateful for the panelists sharing of their expertise regarding healthcare on the island. Thank you for the background and current trend information. I am interested in learning more about healthcare facilities in Jamaica as I work in architecture. Perhaps Nurse Johnson and others could direct me, please. Thanks.
Unmute.
The public health facilities, thanks for that question. The public health facilities are managed by the Ministry of Health and Wellness. And so he would need to be more specific as to what he really wants to find out and in which area. And so that we'll be able maybe to redirect him to the regional health authority that manages those facilities in that region.
Okay. Okay, so Savannah, if you would like to add to your question or perhaps give us an email address or some way of contacting you, we can follow up after the show, okay? The panel. All right. So Dr. Shetty, I believe a question was also directed to you.
Unmute.
Dr. Shetty, you're muted.
Trying to unmute myself. Yes, can you hear me now?
Yes, yes.
Okay, the question was, why in Jamaica so in need of resources that internally exist? Can we set up better infrastructure to disperse necessary resources to all Jamaicans? There is relative poverty, right? 1 out of 4 children live in poverty, but at the same time, there are a lot of people who have a good heart. They're in business, they're in church, and they want to do something meaningful and something impactful. But however, the lack of connection between, say, people like me who need help and they who want to offer help, having to work Monday to Saturday, 12 hours a day, that is really find some time to get out and meet those people. So I think these kind of situations will be very helpful to make the networking and make the contact. But also I think to do something, like for example, I did not want to fund my project with any international monetary funding agency for the reasons I mentioned. I'm sure a lot of my friends who are doctors will understand and help me to start this training. However, to start GoFundMe page, I need to have a US partner or something. And I had to get permission from the ministry. There's no conflict of interest and all kind of stuff. So those kind of things can also limit in terms of how we can bring people who want to help and people who need help.
Okay, there are no easy solutions to some of these problems, right? But we keep on trying. Folks, thank you so much for being a part of this panel this evening. Before we leave though, I would like to say something to all Jamaicans who are watching and participating in this program today. We are all Jamaicans. We love Jamaica. Those of us who have lived outside of Jamaica for any period of time, even though we may have made some changes in our lifestyle, we've gained some information, we've gained some additional resources, usually not money, by the way, but we've gained some additional resources. And what we want to do is, our goal is to give back to the land that we love. Where? Jamaica. Why? Because we are Jamaican. And in how many ways can we do that? In so many ways that we cannot even mention right now. Everybody has something in their hands that they can use. Everybody has some kind of resource, whether it's brain power, money power, influence power, but we all have something. And every little bit, well, let's say it in Jamaican, every miko make a muckle, right? So don't feel like what you have is so small that it can't help. Anything at all that we can do for our country. That's where we were born. That's where we came from. I don't care where we've been, what we've done. We are Jamaicans and we love Jamaica. And therefore we want to give back to Jamaica of anything that we have. Many individuals who left Jamaica have been accused of creating a brain drain. Well, how about if we go back and give brain gain to Jamaica? Free of charge. Free of charge, because you know what I found out is that when you give of yourself freely, somehow it all kind of comes back to you and you have more than enough to give. So I want to ask you today, as Jamaicans, to join us in giving back to Jamaica any little bit that you can, because we said we are out of many, one people, one love. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks.
Thanks again to this wonderful panel.
Yes, I'm can I say, Mrs. Johnson,
Thank you all.
Nice thing. I'll be in touch.
All right.
Yes, yes.